I am so excited for today's episode. Let's be real, I'm excited for every episode that we put together, but this is one I've been wanting to record for quite some time, mostly because I've been seeing a very big and noticeable trend amongst the healthcare sectors and healthcare spheres in this, what seems like a competition between systems. And when I say that, it's a little bit of this conventional medicine versus functional medicine kind of thought process when after today's conversation, you'll probably agree with me that that's not always like the battle that's actually going on, but it is definitely the perceived battle that is going on in the two worlds of healthcare. And I think when you start to really step back and look at each of these systems, you'll understand why what I'm working on and building over here with the low down holistic medicine methods almost shies away from both of these models. And that is intentional. That is because I see day in and day out so many individuals obviously being burned by the setup of our conventional medicine system today, which is humming exactly how it's designed to be. That is a system that is not broken. And I'll talk about that today because a lot of you might be like, what? I think we can all agree that our conventional healthcare system is very broken. And actually, I would disagree. It is not broken. It is actually operating exactly how it was designed to. We just don't like that design pattern. So that's kind of different than it being broken. And also then with individuals who are blatantly not getting the results that they want to see inside of conventional medicine sector, or they just don't have the passion to manage their health with a bunch of pharmaceuticals, they then seek out functional medicine. And this world of functional medicine is the wild, wild west, because you might get wildly different experiences from one practitioner to the next. And that is also somewhat by design. And I think that there are some fundamental flaws in what we have, I guess, started to define as functional medicine. To me is not actually functional medicine at all. And therefore why I abandoned both of these systems and created my own. So if you are new here, welcome to Learn with Lo. I'm going to be starting a little bit of a multi-part series here, walking through the ins and outs behind this, like I said, battle royale between this conventional and functional medicine systems, and also start to talk about today specifically the 4 core principles of what I feel like both conventional and functional medicine are missing, and what has really sparked my inspiration behind building the holistic medicine methods that I use and succeed with in my practice today. So buckle up. This will be a little bit of a big one, not a big one in length, but I might have a few different, how do I say it, like aha moments for us as we start to really point out some of the current state of the state of our healthcare options, and also start to make people maybe connect the dots a little bit into why even their functional medicine experience maybe hasn't lived up to the hype that they thought it was. Okay. So in starting our conversations today, I like to just start with a little bit of the state so that way we're all on the same page of kind of framing the big picture approach that we're looking at from a healthcare perspective right now. I'll start kind of with the honest truth that you probably don't hear a lot of people saying out loud, but I've already said it once, so why not say it again? The current conventional healthcare system is not broken. Okay, you heard me say it, and it is a hill that I will die on. And while most people think, why would you say that the conventional healthcare system isn't broken when we have so many individuals that are going into their primary care providers, they're going to specialist after specialist after specialist and getting handed nothing but medications, or an insurance company that's not approving the tests that I need to have or would give me the answers, or not approving certain medications, right? I am telling you right now, the healthcare system, the conventional healthcare system is not broken. It is not efficient in any way, shape, or form. It is not helping anybody get healthier in any way, shape, or form. It is not getting to the root of anybody's issues in any way, shape, or form, but it's not broken because that's actually exactly how it was designed, is to be a self-feeding mechanism. There's a lot more profitability in a patient that is a recurring patient than there is in somebody that actually truly changes their health trajectory and no longer needs that health intervention. So It's actually not broken. It is a business, is what it is. And that business model is humming beautifully to the tune of billions of dollars a year. So there's not a whole lot of motivation to change said industry. And there's a lot of individuals that will literally fight for keeping it exactly the way that it is. And again, I know it sounds wild because you have seen how many people are sick, they're struggling, they've been bounced around, and prescription after prescription, still no answers. But if you really think about it for a second, conventional medicine and the model that a lot of us grew up in, and the model that most of our primary care providers operate in, it is funded by a very specific ecosystem. That ecosystem is big pharmaceutical companies. They profit off of keeping individuals on medications and actually adding more medications to combat the side effects of the medications that they're on, okay? Like perfect little business model. So we have big pharmaceutical companies involved. We have big medical schools involved here. And these are the medical school curriculum that is training the next generation of these physicians that pharmaceutical companies heavily influence the curriculum of our primary medical school. Like that is what medical school has really become, is like diagnose and treat with a pharmaceutical. It hasn't necessarily become this conglomerate of healthcare where we're starting to see people as like a whole person. It's just not true. So we have big pharmaceutical companies that are feeding the big medical schools, and these big medical schools are just churning out more physicians that then are operating under the big insurance models. And whether you think it is or not, your practitioner within a conventional healthcare system actually isn't the one that's dictating a lot of your care. Your insurance company is. So at the end of the day, when a physician says that they won't order certain tests, or they won't run certain programs, or they won't, use certain medications, it's because your insurance company is dictating whether they are approving or denying the use of that test or the use of that drug for you. And so I just think it's so wild, because then what people are doing these days is you'll see they're like, I need a new primary care provider. I need a new gastroenterologist. I need someone that will listen to me and not just give me medications. And what they're like, and I need someone that's in network with Blue Cross Blue Shield, right? And I mean this with love, but this is the definition of insanity. If you think that you're going to go to another physician that's guided by your same insurance company and get a different answer for a physician that was trained under the same medical system as the other physician was trained in, and is also being dictated by the same insurance company that the other physician was dictated in, it's the same thing. And it's the definition of insanity if we think we're just going to physician hop within the same conventional medicine model, okay? Usually most people think that that's going to be the out. And like I said, this is not a conspiracy theory that I'm throwing out here. This is just the financial architecture at which the system was built. And if you follow the money, it really does make sense why your poor doctor, like I feel for primary care providers. I feel for practitioners that are working underneath this insurance-based umbrella, because they only get 5 to 10 minutes with you because their day is paid out based off of how many patients they can see, right? They're not even controlling their paycheck. Their insurance company is controlling their paycheck, and they're the ones waiting 12 weeks to get paid on an appointment that they served 12 weeks ago because your insurance company won't pay it out, right? So the answer is almost always another prescription, because that's, like I said, what the insurance company will cover and what the insurance company will reimburse them for their time. That's why there's no billing code available for them to say, let's spend an hour together truly understanding why your body is struggling. There's no billing code for that. And why prevention and root cause medicine and lifestyle medicine, the stuff that actually addresses the way that you feel, really doesn't have any financial place in that model. So it's not that that primary care provider is uneducated on it or they don't want to utilize those interventions. Like truly, that's just not the financial business and architecture that they're working within. So this is, like I said, nothing on the physician or the doctor. Like it's largely inside the model that they choose to operate in, and they don't have the tools to do any differently. Like that is their tool of choice, as they were trained in pharmaceutical medicine and pharmaceutical interventions. So if that's not what you're looking for your health, you're probably not going to be very satisfied by that system. But at least once you understand how it was designed, and it was designed for like managing your symptoms versus actually putting your symptoms into remission. It's designed to maintain diagnosis and actually build on diagnosis. And it was trained on pharmaceutical interventions and actually adding on more pharmaceutical interventions for lifetime and long-term medication use, and not really resolving the root cause of anything. You have a choice, right? You just keep throwing yourself against the wall, like hoping that it changes within the same system. We can't expect a system that profits from our illness to be the same system that heals it. We just truly can't. And I tend to, like I said, identify that. I've lived it myself as a patient, and that's one of the main reasons why the holistic medicine methods was born within the Lowdown experience. That, and also, let's be real, moving outside of that financial architecture, we can also do the same scrutiny under our current definition of functional medicine today, right? Which is really kind of the same problem. It just showed up all over again. And if you're someone that kind of got fed up with that conventional medicine experience, rightfully so, I did too at one point in time, maybe you dabbled in or found alternative medicine or functional medicine, and for a minute it felt like, yes, finally, someone is actually talking about root cause. Someone is actually running labs that are more than a basic metabolic panel, and someone who's actually cares about my gut and my hormones and inflammation. And that is like so real, and that matters. I have an enormous amount of respect for other practitioners that decide to practice in more of an alternative or a functional medicine sphere. But what I have watched happen over and over and over and over again are individuals that have come into my clinic having explored some of these functional medicine pathways before, and every single person has at some point kind of found some of the what do I want to call it, shortcomings with this model as well too, because now instead of a prescription for every symptom that you come in with, now it's a supplement that we give you for every symptom. And instead of becoming dependent on pharmaceutical medications for the rest of your life, now you're dependent on other Band-Aid treatments. You have 17 different supplements. You have a low FODMAP diet. You have an antihistamine protocol, and you're like, okay, great. I can never eat avocados again. I can never have gluten or dairy again. I have to take 40 pills a day, and I just don't feel free in that approach. You just traded one handcuff and one Band-Aid for another one that just looks a little bit more natural or more holistic on paper. And it grinds my gears, because that is still incomplete care. And it's still not asking the right questions. It's still not asking the deeper questions of why can't the body hold up itself? That is truly what I think medicine should be, is it should be freedom. It should be autonomy. It should be empowerment on being able to operate on less, okay? And our body really having those self-healing mechanisms and being able to kick those in. So if you have been someone who has felt let down by conventional medicine, and then you felt like you've got let down again by functional medicine, I want you to hear this loud and clear. It's not you. Okay, you did not fail these systems. These systems really were only meant to take you so far. And that's because, like I said, there's not every practitioner kind of sees the human body the way that my brain works and how I train other practitioners to see it, which is more of this holistic medicine approach. So as I break this down, I want to kind of help you differentiate between what are those things that I think are so important to set up in a holistic medicine experience, and some of the pillars that I've really built my holistic medicine models on. And you'll start to see where that doesn't really fit into conventional medicine, and it doesn't really fit into functional medicine either. And that is why, like I said, for the most part, I've abandoned both of those worlds and just created my own, okay? Because I think that we all deserve a system that fully serves us with freedom and autonomy. So pillar number one, and the biggest difference, number one, that you'll experience within this holistic medicine approach is, I call it putting Humpty Dumpty back together again. You guys remember the old rhyme, right? Of even just having all these different parts and pieces to Humpty Dumpty, like an arm and a leg and an eye and an ear and a mouth. And it's like, truly put all of those pieces back together again. This is not something where it should be set up as a system to where you go to your primary care provider and they can only talk about certain things, things. And then you go to your gastroenterologist and they can only talk about your gut health. And then you have to go see an endocrinologist if you want to discuss anything that has to do with your hormones or your thyroid, or you have to go to a dermatologist if you want to discuss anything that has to do with your skin. Every single one of those specialties is only really looking at one piece of this Humpty Dumpty equation. And nobody is standing back and looking at the whole body, right? You are a collection of different systems that operate together. They're not operating in independence of each other. Your gut talks to your brain. Your liver talks to your hormones. Your nervous system talks to your immune system. Your blood sugar talks to your skin, right? It's all one body, okay? So we have to treat it that way. And that's one of the biggest differences that you'll really experience within the holistic medicine model is I'm not even going to come and take the gut out of the body, tinker with it, and put it right back into the same body. Quite literally the definition of insanity if I expect that that's just not going to regress back. We've got to look at all of the pieces together. Number two, which kind of leads into this putting Humpty Dumpty back together again, the number two pillar that you will notice as a big difference is a very strategic and specific order of operations. Your body, just like a house, is built in a certain order. And if you don't build it in that right order, you're probably got some good things going, but you don't have a strategic, systematic approach, and it's probably going to fall flat. So when you think about building a house, you don't put the roof on before you have a foundation or walls up. You can't put the drywall up before you frame the walls in. There's a sequence, right? And if you go out of order, then things are going to be unstable or it just straight up doesn't work at all. This is a process that I call our clinical hierarchy. And within that clinical hierarchy, I teach this with my patients. I teach this with my practitioners. You cannot skip steps. There has to be a very strategic order of operations or you're going to make somebody worse, or better yet, you'll stall them out and they won't feel any better. So you have to think about before the next layer of intervention can happen, what do we need to lay as a foundation first? Blood sugar regulation, drainage and elimination pathways, nervous system baseline, your gut health terrain. Those are, like I said, not optional first steps in my opinion. Like those are the foundation. And if we skip them and we try to go straight to like hormones and hormone balancing or advanced like antimicrobial, I'm going to kill SIBO and kill Candida, or here's a detox protocol and binders, like you're putting a roof on a house with no foundation and it's going to crumble every single time. I've seen it happen 1,000,001 times with individuals where individuals might feel better at first and then they crash and they wonder why they had that experience inside of a functional medicine model. And that's because they were doing things out of the wrong order of operations. I think another really big pillar number 3 that you will notice as a difference in my holistic medicine approach is that I utilize supplements. Yes, definitely not anti-supplements, but these are a bridge. They are not a catch-all. So anytime that I implement some supplements, I'm always letting that patient know, hey, why are we using this? What is the reason and what is the season that we're using this for? And what is the exit strategy? Okay. If you have not talked through those 3 things, including the exit strategy, even if we don't know exactly when the exit strategy will be, but we know what we're looking for and we know when it's going to be appropriate to exit from them. My whole point is that if someone walks away with, and they're like, yeah, I feel better as long as I'm taking these 17 supplements and as long as I follow the strict elimination diet, that ain't it. Like you just paid for a really hefty Band-Aid solution and it's no different than a conventional medicine approach, just with a really hefty out-of-pocket price tag. So this is something to where we should be building a treatment that includes freedom and autonomy, less supplements, more food freedom, less reliance on things outside of us to regulate us, and more of our own internal body medicine kicking in. That's a way different goal than a lot of people think about, especially when it comes to functional medicine as well too. And then this plays very closely into the supplement conversation, but it's probably the biggest one. And pillar number 4 is we are building towards freedom, not long-term reliance on anything. To me, that is health. And from conventional medicine to functional medicine, really just the wellness industry as a whole, is that they think, like I said, the continued participation in anything, right? It's like, I'm on this elimination diet forever. I'm on these supplements forever. If I don't have this lifelong adherence or dependence on these hormones and dependence on these medications, the goal is a version of you that understands how your body works. You own your own body. You trust your own body's physiology, and that body can really regulate itself. It's a body that holds itself up without a lot of those external crutches, and a body that you feel you have full freedom and autonomy over. And you have a lot of resilience. You can travel, you can be with friends, right? It's like, we can live life and not have to make a full-time job out of managing our health, because otherwise that we haven't really got there yet. Because I've watched way too many people, very smart, very health conscious, very motivated individuals, where they trade a dependence on pharmaceuticals for a dependence on this like natural path, only to feel like they're now dependent on some health coach or dependent on some specific diet, dependent on this supplement stack. And it looks different than conventional medicine, but it's actually very much the same as conventional medicine, because they are not free. They're not practicing real freedom in that. They feel like, I can't eat that. I can't go off of this. My body can't function without those hormones. And that's not health. That's really just kind of sophisticated management across the board. So knowing these 4 pillars, knowing some of the limitations of conventional but also functional medicine as a whole, some people they might feel very seen by this conversation. And if that feels like you, know that there is another place to land. I know it can feel kind of big and scary sometimes to throw your trust in another provider when you've been burned by other medical systems in the past, especially when you thought you were getting something different in functional medicine. But I assure you, someone that has lived both sides of these and still found that there's gaps and holes has been someone like myself that has thought through these things and really sought to understand and build something different. So from a patient perspective, if you're ready to experience the holistic medicine model, click over to the link in my bio, snag us a time for a functional wellness consult, which is my initial consultation bundle to really introduce you to this medicine and build you, like I said, your own signature treatment. That's not just this cookie cutter approach or this long-term reliance on external factors and supplements. It's different here. And I hope I get to meet you and experience this. Share with family and friends who you feel like could benefit from this conversation, and come back next week for more Learn with Lo.